Hey Adrian, how's it going? I hope the Viva went well, and yeah, you managed to sort of have some rest as well around that. Good news on the shoulder. Yeah, like I'm not too worried about the execution. Last week, I think if you were struggling with the squats, just good to get some work in. Um, but yeah, good news on the shoulder in general. I think clearly things are moving in the right direction. Um, this might be good news. It could also be a bit of a red herring. It all just depends on what the underlying issue is. I'm pretty sure this is a classic example of some missing rotation through the knee. Um, and that ends up being a bit of a nebulous concept because you can't feel that, right? It doesn't feel like you're missing rotation because how the hell would you feel that? And then, but it does cause these issues of like sort of either within the knee or sort of above, just above the knee. You can also irritate hamstrings sometimes. And then even if you restore the rotation in the knee, the tissue is still pissed off. So you then, even if you restore perfect rotation through the knee, you still have inflamed or like damaged tissue wherever that is, either in ligaments or tendons around the knee or in the muscle. And you try to carry on with your training, and it still sucks. So then you get frustrated again, and you're almost led to believe that the intervention that you performed wasn't effective, but it usually, honestly, usually is. Things with problems with knees typically arise because of either some kind of weak hamstring that shouldn't be happening because you're doing a lot of hamstring work, some issue coming up from your feet, but that usually is one involving rotation, right? So if your feet can't move properly, then the necessary rotation in the sort of the bottom end of your tibia, so the ankle, sort of the shin bone, that can't rotate properly if you can't pronate your foot properly. But again, that ends up being a rotation problem at the knee. And it's solved by the same sort of like forcing rotation drills that I think I've sent you. Or it can be another a problem at the hip. So, and that tends to be again problems that end up limiting, like usually internal rotation at the knee. Sorry, limiting rotation of the femur at the hip, which then translates to a lack of rotation at the knee. So, I think in general I've given you stuff to try for your. In fact, I might have some here. I'm just going to send you this. So this is my generic go-to for like stubborn hip internal rotation stuff. Okay, yeah. Messenger's been super buggy for me since they updated whatever they updated. But yeah, hopefully that's gone through to you. What was I saying? Yeah, so give this stuff a try because that'll then sort of tick off the stuff at the hip being the leading factor here. But yeah, so with the leg extensions, the thing to do here is to do them one leg at a time. So do them single-legged, so that then you can properly load. Assuming so the single leg, so that the leg extensions as a therapy rely on the assumption that that there is some tissue damage, right? Then the tissue damage ends up not being dealt with properly because you're unable to load the tissue sufficiently to sort of get enough blood flow and enough stimulation into the damaged fibers of either the tendons or the muscle. So the leg extensions are a specific way of driving that tension into the fibers that allows the blood flow and the restoration to happen. So then you need to do it single-legged. So I would do that one leg at a time and use the same protocol as a warm-up even on your like non-leg extension days. I would try and do that. In short, it definitely matters. It won't be therapeutic if you can effectively. So like again, the mechanism for these tissue, if this is the problem, the mechanism for these tissue injuries not recovering is that either within the tissue structure or just biomechanically you end up either not stimulating those fibers, so the fibers end up not being stretched properly under load, because you kind of avoid using that leg in the same way, or again because you're avoiding using that leg or system in the same way, mechanically you move around the problem in some way. So I forgot what more it was going to be. Basically, stick with the leg extensions, because then we get to tick that off as a possibility as well. But I would also really still stick with diligently doing that twisting of your tibia into internal rotation to make sure that that is not a problem that is like re-aggravating the tissue, and then we'll see how it goes. With this, let me after this video, let me just double check your program just to check where we are with this, and I'll get back to you with this adding some dumbbell bench. They do look perhaps a little bit more upright than usual. Pretty easy. Just got to remember not to let the easiness sort of make you complacent with setup. I think something to be aware of here, right, sort of as you're doing these, is that it's a good habit to get into to lock the shoulders in before you slack pull. So have your shoulders in exactly the right position and sort of braced before you slack pull, rather than trying to do that like either in very quick succession or simultaneously, because it's very easy for that to go wrong. Yeah, glad benching is feeling a bit better. Does look a bit more comfortable for you. Yeah, good. Yeah. Good stuff. But yeah, hopefully we can clean up the issue with the knees, because that's must be annoying. But yeah, let's try these interventions that I've suggested. Try these for your hip internal rotation. Take a look at some of the drills I posted in the Facebook group for your feet and just have a play with them. Again, like, it won't be the case that these interventions, it's unlikely to be the case that these interventions result in an immediate improvement in pain. What we're looking to do at this stage is improve function such that we're not re-irritating the tissues. So bear that in mind when you're trying to sort of work out which things work, because obviously I know you're being systematic, but it's difficult to be systematic if you don't understand like the mechanisms of the system. So do bear that in mind, and let me know how it goes, obviously, because I'm keen to sort of help you get this fixed. All right, man. Yeah, I'll take a look at this issue with this question rather with the dumbbell press, and I will get back to you. All right, cheers.